You've been treated today in the emergency department for an asthma attack. Having to have to come here means your asthma is out of control. Asthma kills thousands of people every year, and it's important to know that these exacerbations are preventable. This video will give you some information about your asthma, about what happened here today, and what you can do so you don't have to come back here again. Something triggered the asthma attack that brought you to the emergency department today. Probably an infection, some sort of environmental trigger, or not having taken the right medications. Your doctors treated you with inhaled rescue medications to open your airways, and probably prednisone or another steroid in order to bring down the inflammation, either by pill or by IV. If you needed steroids today, you'll need to keep taking them for the next few days to keep you from getting sick again, in addition to your rescue medication. Doctors may have also given you some oxygen if your oxygen levels were low. We'll start by talking about how your lungs work and how asthma affects them and makes you feel sick. You have two lungs, and they're connected to your nose and to your mouth by your windpipe, which breaks up into smaller and smaller airways as it goes deeper into the lung. When you breathe in, oxygen that your body needs comes in and fills the lung, and when you breathe out, waste gases that your body doesn't need come back out from your lungs. People with asthma have inflammation in their airways, which closes up the tubes and makes it hard to breathe through them. People with asthma usually have some baseline inflammation in their lungs every day, and then when you have an asthma attack, the muscles spasm around the airways and they fill up with mucus, making the airways get extra tight. For some people this feels like wheezing, other people cough, and sometimes it just feels like you can't catch your breath, but it's all coming from the same thing. There are three ways to keep your airways open so that you can breathe easily. They are avoiding the triggers that set off your asthma, taking controller medications, which you take every day to prevent the inflammation and reaction, and then rescue medications, which are short-acting inhaled drugs. First, you want to avoid the triggers that set off your asthma. They're different for different people, but things like perfumes, dust, and dust mites, cigarette smoking, either yourself or secondhand smoke, pets and pet fur, plants and plant pollen, paints and other fumes, and bacteria and viruses can all set off an asthma attack. They're different for different people, and your doctor can order allergy tests to find out what your triggers are so that you can avoid them. You may not have full control over your exposure to these things, but if they're triggering your asthma, they're making you sick. If you have to talk with your friends, family, or boss to change your environment, your doctor can write a note or help explain why this is important. Controller medications prevent and control inflammation. They come in different sorts of inhalers, or sometimes in pill form. They're very effective in preventing asthma attacks, but you have to take them every day as prescribed by your doctor, whether or not you're having symptoms. If you had to be in the emergency department today, you probably received either some prednisone pills or an IV steroid. They take a few hours to work, but are very effective. Your doctor will probably have you take these for a couple of days until the worst inflammation goes down. They do a lot to make you feel better, but if you take them for a long time, there can be side effects. When you have an asthma attack and your airways start to flare up, you can control the inflammation with rescue medications. You can take them through an inhaler or also through a nebulizer machine. Both of these work about equally well. The inhaler is quicker, but the nebulizer may be easier to use if you're having trouble breathing. You should always carry your rescue inhaler with you wherever you go. People who have asthma often get used to it affecting their daily life and thinking that's normal. It doesn't have to be. If you have well-controlled asthma, you shouldn't need to use your rescue inhaler more than once or twice a week, and asthma should never cause you to wake up having difficulty breathing or coughing from the middle of the night, or to have any difficulty with your schoolwork, work, or other daily activities. If you're having more symptoms than this, your doctor can help you control your asthma by prescribing controller medications and helping diagnose and manage your triggers. You should start feeling better over the next couple of days if you take your controller medications, avoid triggers, and make an appointment to see your doctor as soon as possible. However, some people do still get worse, so you should come back to the emergency department or see your doctor sooner if you need your rescue medications more than once every 4 hours. You have a new productive cough or fever, or you're short of breath at rest, or have any other worsening symptoms. Remember, call your doctor to make an appointment as soon as possible, take all of the medications that your doctors have prescribed, and avoid triggers that set off your asthma. We hope you're feeling better, and if you have any more questions, please ask your doctor or your nurse.